Hello, everybody. Welcome to Julie's Unknown Podcast. I am excited today. I have Dr. Lisa Fiorenza with me here today, and we met through the Alpha Femme world. And I'm excited because this is someone who's a little bit different, still in the holistic world, which I absolutely love. But it's not, it's not a coach, it's not a therapist, it's not anybody in that realm. She is actually a certified veterinary in acupuncture, Western veterinary herbal medicine, Chinese veterinary food therapy. So Lisa, welcome to the podcast. Please tell us a little bit more deeper of what is it exactly that you do? Because it is a different approach than your classic veterinarians.
Yes. Hey, thank you for having me. So I'm a veterinarian first. I graduated back in 2014. So it just flies by. I can't believe it's been over 10 years now, but it has. And then about 5 years ago, I finally decided I had this longing to go into more of a complementary and alternative medicine world. And I was just a little fearful at first, more so because it's overwhelming when you've come out of school to learn everything just from the Western perspective. And I really felt like I wanted to solidify that before I could move on. And I probably should have done it sooner, but it is what it is. So time got me here when I was meant to be. But I got my certification in veterinary acupuncture back in 2020. And then shortly after that, got my certifications in veterinary Chinese food therapy, which deals a lot with food energetics, and then veterinary Western herbal medicine. And I've also done intensive studies on Chinese veterinary medicine, veterinary herbal medicine, and a lot of studies on microbiome therapy. So I do a lot of fecal transplant therapy for a lot of GI and immune system issues, and ozone therapy, and lots of other avenues. So I kind of have dabbled in many places and really solidified my knowledge in a few others. I came from a background of having my own chronic pain issues, and having found that Western medicine really wasn't working for me for that, I developed my own interest in acupuncture and alternative medicine through my own issues, and then saw my patients struggling with chronic things that we weren't making real progress on. We were just masking symptoms for a lot of issues, and decided I needed to introduce that into my own practice and do better for these pets. So that's how I came to be here. And it's been a very interesting ride. I mean, there's so much knowledge out there, there's so much information out there. It's overwhelming. There's just so much. So I am constantly doing, more learning. I'm so interested in all of these avenues. And sometimes you have to step back and be like, okay, let me make sure I know some things in a very solid way, and then we can kind of move along to other ones. So it's been a really fun ride with that.
I love that. And it makes a lot of sense as to why all this information is available, but I didn't know about it at all. Currently, I don't have any pets, but I grew up in a household where we went through many, many cats. And then we also have a dog. Well, my parents have the dog. And you learn what other people tell you. You go to the vet, you learn what you learn through there. And I know my mom, she only has my dog. So, and both me and my sister are out of the house. And so basically the dog has replaced us. Uh, and so she creates makes her meals and everything. And that's the
Oh,
only
that's awesome.
extent I have known is certain things of what are good for dogs. But I didn't know there was this whole other element until I met you. And I was like, oh my God, this is so interesting because it shows more and more how similar we are to our pets. We may not be completely identical in some ways, but there is other elements such as food intake. As we know, as humans, it's really important what we choose and what we put in our body. And the same thing goes for pets. And I know many of us have heard that the classic brands that you go find at the grocery store, a lot of those can be considered like junk food type of food for pets. So what can you like explore a little bit, like what have you learned? What have you explored in that element with food and, feeding the right meal
Right.
to your
Yeah.
pet?
Yeah. So just like us, and you really, I mean, you hit it on the head. They are so much like us. There's so many similarities. People, pet owners every day are surprised by certain diagnoses that their pets get because they're like, they can get that? I'm like, yeah, I mean, we're very similar. Cats and dogs are a lot like us. There are certainly differences with some other species, but all in all, mammals are mammals, and we're not that different. We're really very similar. Gut health and in food intake is the basis of everything. So again, just like we think of in the holistic human world, it's super important. What you're putting into your body is going to really give you a good indication of what you're going to get from your body. So the traditional veterinary foods that are out there, your classic kibble and canned foods that we think of, like you said, in the pet store, in the grocery store, unless you're really already into this realm and looking at other ways to feed your pet, those those diets are super processed. And there's something called advanced glycation end products or AGEs that this is a huge thing in both the human and the veterinary food world. But AGEs are a byproduct of high food processing, especially when you have protein and sugar together. So a lot of your ultra processed foods, a lot of your heavily cooked foods, things like bacon, where you've got that protein and sugar together. They're a classic for humans, but those advanced glycation end products cause a ton of inflammation within the body. So anytime you're feeding those highly processed foods, you're increasing the inflammation in the body just through that food. Unfortunately, there's a lot of misinformation that veterinarians are told in vet school where you're essentially taught that if you're feeding anything but kibble or canned foods, especially from, the big, what is it, 4 or 5 brands that are out there nowadays, who knows, but they, your pet is going to die because you're feeding them a poorly balanced diet. But how many of us are eating, I mean, none of us are really eating the same thing every single day, humans. We're certainly not eating cereal in a bowl with no milk 3 times a day for our entire lives. If you are, you're probably not feeling great. I mean, maybe, kids are very forgiving, but over time, it certainly adds up. Um, but you can make a balanced diet at home, especially for dogs. They're pretty simple. Cats are different, they're a little more difficult, but you can definitely do a balanced diet at home. And nowadays, even if I mean, time is a huge issue. Like we have 2 kids and we have 4 animals in this house. So prepping our own food is a lot. It doesn't necessarily happen, but there are so many pre-made fresh foods out there now, both cooked foods and raw foods. Those are absolutely at the top of the list. If you can't do home cooking because you're either overwhelmed with, you're worried or you don't have enough time, you can certainly spend more to do the pre-made foods and get a really good outcome as well. If you've ever heard of the anti-inflammatory diet, it's the same kind of idea. You're trying to avoid those highly inflammatory foods, and all processed foods are on that highly inflammatory list. And so many pets will have a very big improvement in just food change, regardless of what their issues are. I've had a number of pet parents come in and tell me, I changed my pet's food to something fresher, and they're more energetic. They're playing more. They're more like they were, a few years ago when they were younger. And that's just one change. That's just the food. That's not even everything else that we can do. So it really solidifies that idea that the gut is the basis of everything. And for anyone who's familiar with Chinese medicine, that is really, I mean, that's like the tenet of Chinese medicine. You're treating the gut to treat pretty much everything else. So it's so important. And I've been, I mean, I understand where other vets are coming from, where you don't know what you don't know. But at the same time, I've had some pet owners come to me and tell me that their vets really berated them and that they felt terrible about that experience because it's, you know, I think it just gets to this point of um, there's some hubris involved. You really think that you know best and there's no other way. And I feel for those clients, for those pet owners that, they're trying to do something different and they're being really scolded like children for doing it when they're actually doing a really good thing. And sometimes, sometimes it's not exactly right and we have to make changes, but it's still, I'm hoping that we see the veterinary industry continue to go in the fresh food direction because of the number of even the big food companies are now, they realize how much money there is in it. So they're actually getting away from the processed foods too.
Yeah, I definitely feel for people who get berated because like I've been myself in like situations like not necessarily like pet related from a vet, but in other situations where I'm trying my best to do what works for me, right? And then you have someone that you would consider in your life an expert, right? In whatever they're whether they're a doctor or a mechanic as another example. And then they're like, no, you shouldn't be doing this, but they actually make you feel bad. And you're there
Yeah.
like, wait, why? I'm just doing my best. I
Yeah.
don't need to be like told down. How about you support me or find a different approach of explaining it?
Yes, exactly.
And I love that you did bring up, especially like that it all has to do with the gut health. And I think like even the more I'm learning about like human food and processed human food, like I'm going to the grocery store and I look at labels now. Sometimes it's a little hard because
Pet
there's
food labels. Go
there's
ahead.
yeah, but there's just like so much crap and so many things in human food. And then
And it's hidden. They use these crazy words,
I know. And you're like, what is this? So now the only thing like I know to look at is at least the sunflower oils and all the seed oils. Like to me, that's like a good, I'm starting there because some of the other stuff, I'm like, I don't even know. Like for the longest time, I thought oat milk was healthy until I read the ingredients and it says there's sunflower oil in there.
I
And I was
know. I
like,
know.
well, I thought I was doing the right thing. And so when it comes to pet food, like I know for myself, like when I would buy for like, my cats and, my dog, like I never looked at the ingredient. It wouldn't even cross my mind to think of it. It was kind of automatic. Oh, this is what you get. So what would be, obviously, as you know, like there are the five big major brands, but what would be maybe like one or two items like on an ingredients list that you can say that would be a red flag to avoid?
So I mean, some of it is similar to humans in that you want to avoid colorings and things like that. What I find in a lot of canned foods, I would say dry foods, it's not necessarily that I see a lot of bad additives. It's more so that, first of all, they're super dry. You're not getting any fluid intake through your food, which is no good for anybody, but especially cats, because they're so prone to kidney and bladder issues that we're promoting that by giving them an incredibly dry diet. They're not made to drink water, they're made to get their fluid for their food from their food. They're only going to supplement their water intake a little bit from that with drinking, but they're eating in the wild, they're eating fish and small rodents, and those creatures are all 70% plus water. So that's where they get their fluid intake. You put a dry bowl of kibble in front of them, it's now at least 50% carbohydrates because you can't make kibble without it being half carbohydrate, and it's got no fluid in it, and it's incredibly highly heat processed multiple times at these ridiculously high temperatures, and that's going to cause a lot of inflammation in the gut, cause not necessarily symptomatic, but low-grade dehydration lifelong that's going to impact the kidneys and the bladder. It's going to increase insulin resistance and cause diabetes. So it's really detrimental to them. With the canned foods, there are definitely some additives that are more problematic. So I would say the majority of cat food that is, and actually not even cat food, but fresh pet, I always have a big issue with them because they market themselves to look so great. And from what I've seen, I haven't dived really deep into looking at them, but I think a couple of their lines might be better. But pretty much most foods that are in a can that are in some kind of pate form, so they're not like chunks of like shredded meats and stuff. They usually have some kind of additives to make them thicker. So carrageenan and other gums like guar gum, xanthan gum, agar gum are in most canned pet foods and in a lot of the fresh pets. So those are some big ones I would look out for. They're very inflammatory to the gut. And there's a couple of canned foods that don't have that in them. But they're in most. So you have to look out for it. And even some of the like liquefied ones that are a little more broth-like is another one. The other thing I would be careful with, and it's not so much an additive, there are some foods that are just meat. And while that's great, it's not good for constant long-term feeding because you're not getting any vitamins and minerals in that. You're not getting any calcium, so you can actually cause a lot of damage with that. So you do need to feed something that is complete and balanced for the long term. If you're adding in something like, I know Applause has a lot of foods that are just the meat. There's a bunch of others out there that are just the meat, and you can use them as a treat and, maybe intermittent feeding, but you do have to make sure that that's not all you're feeding. Because if you don't have those minerals in there, you're going to run into a lot of trouble over time. So months down the line, there's going to be issues.
Yeah. Yeah, interesting that you mentioned the guar gum because that's also in a lot of human stuff. Like that is another key ingredient.
Ice cream.
Coconut milk.
Oh, yeah.
I'm there, I'm looking at them like guar gum. Oh, okay, this one that's $5 does not have guar gum.
And I mean, there's a difference between having it once in a while and it being in all of your food that you're eating. So I would say if you're putting a splash of coconut milk in your coffee, you're probably okay, especially if it's not all the time. But if you're eating this canned pate and it has guar gum in it every single meal, that's going to make a big impact on your gut health.
Yeah. Yeah, exactly. Like, and that's kind of what I've done, for myself is paying attention to the ingredients, but no, I can't avoid everything.
Yeah.
Yeah. Yeah, no, that is definitely really interesting. And it's like the little things that you can sit and pay attention to. And when you even mentioned when you said, look at what they eat in the wild, they're not meant to eat dry food. I'm like, yeah. Well, even if you like go in their like feline lineage, right? You look at what lions eat and what, all the other cat animals, like I know I don't have the proper scientific terminology right now, but what lions eat, cougars, like they don't eat dry rocks.
Exactly. And there actually, I will mention something because it's related to that. There are some people who say like cats can't have plants. Cats can't have plants. And to that, I will say they're eating the whole prey, including their stomach and intestine contents, which are plants. So it's not that they can't have plants. I mean, I'm an herbalist, I'm biased, but still, there are tons of great things that plants can give to cats and dogs as, huge nutritional benefits. They are for sure meant to eat some of it. It's just not necessarily, they're not eating salad,
No. I've seen them go eat like grass outside. That's a
grass, a big one.
Very big one. It's very common, like with both, like it was both with my cats and the dog I had. Like they just love love the grass and they're
Yes.
eating away. And I'm like, okay, cool. Like we didn't stop them. What
Yeah.
are we
Yeah.
supposed to say? Like, well, the one thing with a dog, there's training, but with the cat, we didn't really do any training with them. So it was kind of like, oh, you're supposed to say stop, don't eat that. They're not
Yeah.
going to listen.
And there's a bunch of different reasons. I mean, obviously, if you have like a lawn that's treated with chemicals, then yeah, you really want to stop them. But
Yeah.
the grass itself is not harmful, and they might be doing it for a number of different reasons. It can be, I do think of it, I think of stomach upset, like just low grade chronic GI issues as a potential reason for it. It's not always the case, but I always think about it, especially if there are gut symptoms. But they can just, it can be boredom, it can be self-medicating, like they will do it if they feel nauseous and they want to make themselves vomit. So there's a lot of different reasons, and it's not necessarily detrimental, but it can be telling you something.
Oh, interesting. Because I
Hmm.
do know a lot of them when they would eat grass and then some would vomit right after.
Hmm. Yeah, so
So
they're treating themselves.
interesting.
Yes.
Interesting. I know with my cats, if they were hiding for a long period of time, or, well, one cat, he left the house for 3 days. We were really worried, and he came back. He ended up actually having a urinary blockage. And so these small little things of like when you start noticing like these little behaviors, but we do the same thing as humans, right? When we don't feel well, we kind of we cocoon. We don't
Yeah. Yeah.
sit and all of a sudden go party. I mean, unless we
Right.
were 20, right? Where we could tolerate anything.
Exactly.
So I love that. I love bringing this topic of, how we are so similar to our pets. And so what are some things, because I do know there are certain things that we can learn from our pets. So what are some things that you've experienced where if there's something wrong with your pet, like if they're not feeling well and but maybe you might not know what it is, like what is it as like a human that we can kind of get curious about it outside of just bringing the pet to the vet?
I've seen over the years so many pets and people have the same diagnosis, like in the house. Some of them are really simple. A lot of my patients with GI issues will have pet owners with GI issues. A lot of my patients with anxiety will have pet owners, parents with anxiety. And I think the anxiety piece is really interesting, and to an extent also the gut piece, because there are so many. The gut relationship to anxiety is so prevalent. IBS, where you have this emotionally geared gut issue, is really prevalent in both pets and in people. And I think one thing that always strikes me is that I feel like they are a really good mirror for us with how stressful life is nowadays for us, where we are always trying to do a million things. I think they can kind of teach us that, how unhealthy that is, and that we do need to step back. So that's always been a really interesting area for me. So to put it into context, I will have pet owners who come in, and when you can just feel the anxiety off of somebody and you're like, oh boy. And the pet is super anxious because they're feeling this anxiety from the pet owner too. And it's, that's their parent, that's their caretaker. So if you're anxious and vibrating with tension, your pet's going to pick up on it. They're going to be super anxious, and it's going to be detrimental to them too. So your anxiety might be feeding their GI issues and other problems. I'll never forget. I had a really interesting. This was, oh gosh, it's probably at least 5 years ago, when my old man kitty Regis, who passed last year, he developed a liver mass, and I actually connected with an animal reader who did a distance reading on him. And she told me that, she was asking me if I was having any issues with anger at the time. And I had to stop and think about it. And I was like, okay, yeah, I guess there are some places where like I've been feeling angry. And she was like, I think that is in part where this liver tumor developed. And what's really interesting to me with that now, which might not be lost on others, in Chinese medicine, the liver is the organ that is responsible for anger.
Mm.
So now I'm in this context of what? How did this happen? It's mind blowing. And that might be a little woo woo for some. I mean, maybe for your audience that's going to work, but for some, I would not necessarily share that. There have been others that are, undeniable. I mean, like I said, the GI and the anxiety you can maybe kind of brush those off. I've had many pet owners whose pets were diagnosed with epilepsy and they had epilepsy. I had one cat who had a bladder tumor, whose dad had a bladder tumor. I've had multiple pets where they have a skin issue and their parent has the same skin issue. So there's so much that I think I'm sure it's multifactorial. I think environmental exposures can always be part of the issue. I think that anxiety piece probably feeds into a lot of these things. And I think that they really truly absorb our energy and take on things for us. So it's just another good reason to learn to protect your own energy and work on your own energy, in my opinion.
Yeah, and then that is really interesting because like even in the spiritual woo-woo world, which is my audience, this is why they're here. I believe a lot in you, like everything around you is a mirror. So, your relationships, like if you have kids, your kids, and it's all there, like the little things that trigger you or the little things that happen outside in your external environment is there for you to learn more about yourself and whether it's to shift perspective, heal, change, or whatever it is you're meant to do in that moment. Doesn't always mean you need to heal, but it's all these like little things. And so it makes sense that your pet is there for the same reason. It just looks differently. It feels differently. I would wonder though if, and like this is just me off the top of my head, where, there's a lot of pets, especially dogs, who have that separation anxiety with their owners. I feel like that is a very common thing. So would that, for like the owner, would that look into like ways they're codependent on other things? Because I
I
would,
bet so. I would
yeah.
bet. Yeah. Well, I mean, I would also say you can see that same thing with kids, because if you're not creating healthy boundaries with your kids, you're going to create that separation anxiety and that extreme neediness, that unhealthy level. And I think with the pets, it's the same thing. I think there could certainly be a facet of time is a precious resource, and not everyone is equipped with the knowledge or with the time to do a lot of that same work that you would try to do with kids with their pets. And essentially what I mean is training. So for the pets, it's training. So if you're not able to, or you don't know to put that time into working with your pet, I think that could certainly create those same issues. But I wouldn't be surprised if there are it would be really I can't ask my pet owners like, if your dog has separation anxiety, do you have codependency issues? It's a little awkward, but
A little bit.
it would be very interesting to find out. I don't know how we would set that study up,
But it would
yeah.
be it would be interesting to like just get like obviously like if you ever more have a friend that you can like
Yeah.
talk to with this to see that if they begin healing their own codependency issues,
Mhm.
would that ripple out to the animal? I that for me that would be a very interesting study to see that
Yeah, it would be.
because right now from what you've experienced, it's a lot more medical, physical issues. And so then it's like, well, what if we start healing some of as humans, we start healing our own emotional issues? Because I
Mhm.
know in energy healing, such as Reiki and integrative energy therapy, like in energy healing, when it comes to pets do provide energy healing for humans when
Mhm.
we're feeling low. That's why they come near us. Like they give us their own energy and they help us heal us. But then it's like, who's there to heal them?
Yeah, yeah,
Right?
exactly.
Who's there to
Right.
replace that? And then that's why there are practitioners who do Reiki for dogs and
Mhm.
cats, and there that does. So it would be interesting, like because they're healing us on an emotional level, if we were to just take ownership of that, start healing our emotions, I would love to see what the outcome would be for the pet. I would really
Yeah,
love that.
it would be really interesting. I'm sure you do get those learned behaviors that I don't know. I feel like fixing your own issues would probably help in that same way that taking care of your own um, issues is going to kind of trickle out to the people that are close to you. But in human world, those other humans still have to do their own work, and I kind of think there's probably a component of that in the animal world. So I don't think they're going to sign up for, Alpha Femme, but
Yeah.
we'll have to talk to Melanie.
Yeah, right.
But I think, it probably would, because I think that energy would be improved and that's going to benefit. It may not be the whole puzzle, but I think it would probably be beneficial. I do talk to pet owners, especially like I remember going through one of my really good friends, her like soul dog developed a really nasty tumor, and we kind of knew that like we were doing everything we could, but this was not really, we didn't think this was going to be curable. And she was devastated. And there were times that I had to talk to her about, she's feeling your energy, and you do, like, I get it, you do have to clean up some of your energy and you know try to deal with it away from her, because she's going to try to take it from you more, because she doesn't want you to feel this. And I do talk to some of my other pet owners about how much their energy does impact their pets. So again, I think the gut cancers, anxiety patients, maybe skin too, because but really, I mean, it's true for every disease. I will talk to them about how they do have to make sure that I think anxiety is the easiest place to see it. If you're coming in super anxious, I'm not going to be able to work on your pet because they're going to be super anxious. Their anxiety is not going to get better at home. Their gut stuff's not going to get better at home because they're feeling your anxiety. So we do have to work on that aspect of ourselves to help them too.
Yeah. Yeah. And it's interesting how different parts, like even how you said earlier with the liver and cancer and
Mm-hmm.
skin, it's associated to different elements of like that you can get curious, especially in Chinese medicine, of like getting curious about yourself, and what it is that your pet is taking on from you. I don't know as much in Chinese medicine, but I do know like the chakra system very well. And I know anything like around the root chakra, which is like the base of the spine, or anything below that, the knees, the feet, those areas. If there's any issues there, I know for sure that has to do with either money, basic needs, shelter, like that's all everything around the root chakra. And so if you are someone who has a pet, I would assume, like anything around if they are having needs issues, like maybe check in with yourself. Are you stressed about money? Are your basic needs stressed? Do you not feel grounded or supported in life? And those would be areas to kind of get curious about.
Mm-hmm.
And just because I see that so often with people around me, where like I was just talking to my partner the other day, and we have a friend of ours who had something wrong with his like spinal disc, but we didn't know where in his spine. And I was like, oh, I'm like, well, he's been a little stressed with like money and those things. I'm like, well, maybe
Mm-hmm.
it might be like his lower spine. Then we went to go see him, and it was his lower spine. I was like, I
Yeah.
can't make this up. I can't make this up.
What just came up for me is when you said earlier in the beginning how you usually you tend to have therapists and coaches. I always joke that we as veterinarians are 50% therapist, 50% pediatrician. So I'm like, well, yeah, it just fits.
Yeah, well, it makes sense, right?
Mhm.
Because like for a lot of people, I would say a good chunk of people, their pet is their own therapy. And
Mhm.
then something's wrong, go to the vet, and then
Mhm.
you're emotionally supporting them through that as well. It's not just like, oh, let's see like what
Right.
we can do to like fix it, but you're emotionally supporting through this time, especially if there's like major decisions to be made.
Yeah.
Since a lot of the stuff, well, not, I don't want to say a lot of stuff, but the bigger major decisions can be a lot more money, and this is where it can really be challenging for pet owners of
Mhm.
not having 5 grand to for surgery, for example.
Yeah.
And so I can definitely see how that emotional support, as you are a therapist for both the pet and their parent.
Yep. Yep.
um I would love to wrap this up like with one more question, because I am really curious about the acupuncture element. How have you used that with pets? I know how it works with human beings, and I know it has many great benefits. Like I love
Mhm.
acupuncture. How has it worked with pets? And especially like, yeah, like what is your experience with it? Just like in a nutshell, if you can explain a little bit.
So it works really well. What I find really interesting, and I say this to people a lot, I think with pets, there's really no placebo effect. If they feel better, it's because they feel better. It's not like us where you can take a placebo pill and you don't know what it is, so you can think you feel better because of it. If they're showing improvements, it's completely real. So I've always thought that that's so much fun with them.
Can I add
Uh,
something really quick to that? Because like,
yeah,
so I've explored a little bit about human design pets, not much,
okay.
a little bit. And for those who are into human design or are listening to this, you will find this interesting because what you just said, so pets, just like I guess mammals do not have a head or ajna center. So head is the thoughts, ajna is the opinions. So they don't
Interesting.
have those two centers, and they also don't have an emotional center. They have
Hmm.
gates, two gates out of the emotional centers, which that would mean like their behavior, happiness, sadness, but they don't actually have an emotional center either. So interesting that you say that it's like when they feel better because they don't have the head, the like
They're
the
not
opinions and
thinking
the
about
thought
it. Oh,
thinking.
that's so cool. Yeah.
I just wanted to jump in with that because I thought that was really interesting. So
Yeah, that is really interesting. But so yes, I mean, if you've ever had acupuncture yourself, then you have at least some context for it. But basically, what we're doing, I do Chinese medicine, which means, or Chinese acupuncture, which means that we're not treating specific points for Western diagnoses. We're getting a Chinese diagnosis, and then we're treating points for that. But we're essentially taking small needles and we're inserting it into the points that we want to use for what we're seeing in that pet. So it's an interesting way of kind of taking many different symptoms and problems and trying to boil it down into something more simplified and being able to treat in that way. Most pets might be a little bit anxious when we get started because I'm poking them with needles and it's really weird, but they are really small and usually I'll always start with a calming point. So after a few minutes of that calming point, many will relax and they'll kind of calm down a bit and then we can keep going. And I usually take 10 to 15 minutes for the needles to stay in. It's going to depend on the pet again. They're not humans. They're not going to lay on the table perfectly for me like I would, but that's okay. We kind of work with it. Some of them will walk around a bit or they'll like go from standing to laying or laying to standing. I just kind of let them be. I try to keep them from like going on a marathon, walk around the room over and over again, but they don't have to be perfectly still for it. They're going to be fine. We might have a couple needles fall out a little prematurely because of it, but again, it's going to work fine. The needles don't necessarily all have to be in for the entire time for the treatment to work. I've had many who I've actually even had. So there's 5 different personalities in Chinese medicine, and some of the much more anxious ones we know will actually respond very well to fewer needles. And I had one little dog, and she came in for acupuncture, and she was like the little Napoleon complex. She's like, I don't want this. What are you doing? And I just placed one needle, and she relaxed. And mom was like, she was fine. Like she was so much better for a week afterwards. And that was it. It was just the one needle. We didn't even do any more because she was just not a dog that was going to allow me to do more needles. But she actually had really significant improvement from that one needle. And I was like, wow, that's amazing. So that is really like that idea in process. And so that made me a believer that it really is true that some of those personalities don't need a whole bunch of needles. Usually I'll do maybe 10 to 15, maybe up to 20 total. But there are some where I will do less because they are a little too anxious, and more is just going to push them into more anxiety, but they still have a really good response. And I just tailor it to each patient. Some are totally cool with it and don't care. Some of them are like, don't touch my feet. If you touch my feet, we're done. So we won't touch the feet. So it's just tailored to how they respond. I've treated, I, I don't even know how many dogs and cats, more dogs than cats, but I have a bunch of cat patients too. Um, I've treated some bunnies, a few reptiles, and a couple other like small mammals. So it's really interesting. I don't really do horses and large animals, but now I'm in Eastern PA, so now I'm kind of like, I should go back to working on them too. But the majority respond really well. I've had very few in the 5 years that I've been doing this that I really didn't think that acupuncture was a good option for them because of how they responded to it and just like their anxiety level. So the vast majority do really well. Musculoskeletal stuff, like any kind of pain, back issues, joint issues, knee tears, those are probably the best responders. They'll respond the fastest and the most dramatically. And then I use it for all kinds of internal diseases as well: anxiety, gut stuff, kidney disease, liver disease, immune disorders, skin stuff. I mean, you name it, like we can work on it with acupuncture. And I'll just incorporate other things like the fresh food basis and herbs and supplements to get good results.
Yeah, no, I love that. And I think that even as you were saying, some were just like not for it. And that makes sense because it's kind of like as humans,
Mhm.
not every modality, not every tool is for all of us. I know for myself, EFT tapping doesn't do it for me, but breath work, love it. So, everybody has their own, and it makes sense that some animals are like, no, and you got to trust the energetics of that, the energy of the animal. And as you were saying, like some just need one and then some need 20. And it's reading the energy. So I love that you read the energy of the animal and you're like, okay, let's
Yes.
kind of see where they're at, what they're feeling. And I know I do it because I've had experience with growing up with total 6 different cats. So there, at one point, I think the most we've overlapped was 4 in the household. My mom sure went crazy with the amount of hair. But what I did learn is that how different every cat is, and then how
Mhm.
they don't, not like some like to be touched in certain areas, some don't like to be touched in
Yeah.
certain areas. I assumed in the beginning that not all cats love to be touched on their belly, but then I had two out of those six cats that loved it. And
I know. I
it's
have
so interesting.
two. And I'm like, what is this? You want belly rubs? Are you kidding? Are you the wrong species?
Yeah, they'll just go on their back and you're like, okay.
Exactly, exactly. And I love it. I'm like, okay, this is great.
Yeah. And it's just reading that energy, reading even when I meet new cats or any new dog friends. I just let them come to me. I kind of
Mhm.
like, and if I do pet them, I pet them, but then I feel their energy. And I know there's one cat that if like it's a friend of ours and it's like he loves to just like come on your lap, but does not want to be touched.
Okay, yes. The typical cat. It's like the I will come to you
But don't
and that's it. Don't touch me. Yes.
And the first time I like went to like, oh, like let me pet you, I've had cats and hissed at me, almost swatted me. I was like, okay, that's cool. So
Yep.
you just read the energy, and it's the same thing with
Yes.
what you're doing in your holistic medicine approach is reading their energy, and it's like not forcing, not touching them in areas they don't want to be touched. So I appreciate that and I
Right.
respect that.
Yes. Yes. 100%. It really helps too with handling. I mean, I'm not a big believer in forcing the animals to do anything. I do a lot of minimal restraint handling. And when I need to, I'll rely on muzzles because I need to, not get bit. But at the same time, I feel like they usually are more comfortable wearing a muzzle than they are being tightly held. So whether it's cats or dogs. So I do have a fear-free certification as well that I've done. And that kind of just solidified a lot of what I was already doing. But I've always been very good at reading their energy and knowing, you know, when I need to be careful and when I can do the minimal and when I have to adjust.
Yeah. Yeah, and I love that you brought like the muzzle with like held tightly because I remember it was like so simple. I was like volunteering at one of the pet shelters here. And so they do like the two leash for dog walks because they just want to make
Mhm.
sure that if you drop one, at least you
Yeah.
don't lose the animal. And when I was like at the crosswalk, because it was like red light, I kind of held tightly, but you see the dogs ready to pull away. And
Yeah.
the minute we started walking, I just loosened it up, and then they're like, they're
Hmm.
loose. And
Yep.
it's just
Exactly.
so simple. And you see that all the time of like owners walking their dog and they're just holding on tightly. And it's like the dog is like pulling. And you're like,
Mhm.
if you just loosen it a little, relax a little, the dog will chill as well.
Yeah. Yeah.
Unless they see a squirrel. And then I mean, well, that's a different
Oh, yes.
story.
My hound is gone at that point.
Yeah. Oh my God. I love this conversation. I thought it was extremely interesting, very much like very different, and I love having you on.
Thank
How can
you.
people connect with you, find you if they want to learn more? How can they find you to figure out how to, do the do's? Like what is, the right way? So where can
Mhm.
they find you? What do you have going on? Please share.
Sure. So I do both in-person medicine in Eastern Pennsylvania. I'm in the Poconos region. And I also do a lot of telemedicine. So I can really work with anyone throughout the US and Canada, where I can just help to kind of coach you through some of the holistic things that can be done. We can work on supplements and herbs and food. We can do certain functional medicine testing if we want to, talking about personalized vaccine planning and other things. So I do tons of work there. You can find me on Facebook and Instagram. Facebook is, I am facebook.com backslash Dogtor Lisa, Dogtorlisa. I was very excited when I got that one. And on Instagram, I'm at Dr. Lisa Holistic Vet. So either of those locations, you'll be able to get onto my link tree and get my like email and everything if you want to reach out. Yeah, so those would be the best two places to find me and be able to connect.
Perfect. I'll have those in the show notes.
Thank you.
And so people who are listening while driving, you can just check out the show notes after you're driving and click on links. Go give her a follow. Go check out what she's up to. As you mentioned earlier, you're dabbling into all the things and you're continuing to learn. So can't wait to see what the future's in store for you. And
Thank you.
thank you so much for being here. And
Thank you for having me.
of course, and for the audience, I will catch you all next time.